Hello, everyone. It is your girl, Marcie Thomas, here with another episode of Live Well Sister. So come on in the room, everyone. We are about to dive into a really great conversation on this Wellness Wednesday. I normally don't say that, but at the time of this recording, it is actually a Wellness Wednesday, and we are actually going to talk about our health and well-being on this particular episode. So I am coming to you from the outskirts of Atlanta, Georgia, by way of Cleveland, Ohio, and a bunch of other places in between. So if you're new here, if you don't mind shouting out where you're joining us from, that would be really great, just so we can know who all is here and who is represented. So as you saw from the opening, if you caught it from the beginning, Live Well Sister is about a lot of different things that pertain to our ability to live well, whether it's our spiritual life, our relationships, our self-care and wellness, finances, all those sorts of things, as well as community. And tonight we're going to be talking a lot about community as well as our health with a very, very special guest who some of you have seen before in a different capacity, and we're going to dive into that here in a little bit as to where you may have seen her in this space before. So our special guest for the evening is double board certified in internal preventive medicine, public health, and internal medicine, Dr. Ayanna V. Buckner, who is the founder of Atlanta's Community Health Cooperative, which assists organizations with program planning, implementation, evaluation, and other activities associated with community-based health programming. She has also served as an associate professor in the Department of Community Health and Preventive Medicine at Morehouse School of Medicine. And she has so many great things. I won't be able to describe them all, but one of the others also includes her service on the American Heart Association's National Hypertension Control Initiative Advisory Group, and much, much more. She received her Bachelor of Science degree from Xavier University in Louisiana, and I do remember that she is from Louisiana, so I remember that, and her Doctor of Medicine from Meharry Medical College. And without any further delay, because we can talk about many of her great accolades as we dive into conversation, welcome to the room, Dr. Ayanna V. Buckner.
Hello, welcome. Thank you so much for having me.
Yes, it's such a thrill to have you back again. Okay, we got somebody joining from your neck of the woods. Okay. Mm-hmm. All right. And someone just giving a heart. So thank you so much for being here and taking time out of your very, very busy schedule to join us and to be able to come and talk about something that matters to all of us, and that is our health.
Yes.
Yes. So in particular, just a little bit of background, what was it that drew you to want to get into the medical field or the health field, and also to go into public health? Because that's a whole different aspect of being in medicine or the healthcare field.
Right. So growing up, I really wanted to be a fashion designer and an actress. But I was 16 when I graduated from high school, and my parents weren't keen. Well, my parents put me in school early, and I changed school systems, so I skipped a grade. So that's how I ended up graduating at 16. And so I wanted to go to New York and study fashion design and acting. And my parents were like, no, you're 16. And so I wanted to go New York or nowhere else. So I said, fine, I'll be a doctor. And people are usually like, wait, like, how does that even make sense? But, as you mentioned, I went to Xavier University in New Orleans. And during the summer, each summer before, whatever science class I took in high school, we would take a summer program to prepare you for that. So before biology, I did a program around biology called BioStar. Before chemistry, I did one called ChemStar. And so those were actually pipeline programs that were designed to increase the African Americans, or the number of African Americans in medical school. So I always like to explain that, because those programs worked. I mean, here they took someone who was really into the arts and convinced me to become a physician. And so to your question, why was that the case? For me, science was always a subject that I had to actually work at to get A's. I was kind of an A-B student in science. And so it was a challenge for me. So part of it was that I enjoyed the challenge of it. But just from all of the things we talked about in those summer programs, I really started to think about all the people I knew in my family, in my church, in my community, who I didn't think really understood enough about health. And I said, I want to go to medical school and become a doctor so I can help to explain things to people who look like me. And we weren't talking a lot about health equity. No, we weren't talking at all about health equity or health disparities. We would talk about the fact that, there are higher rates of most chronic diseases in the African American community, but we didn't really have a phrase to put on it. But that's essentially what I work on every day now. And that's what drew me to medicine.
All right. And we need people like you in medicine, because we know, 2% of all physicians are African American? Is something like that? It's a real low number. Something like that.
And it's getting better. But it really does make a difference when a patient can connect with a provider. And one of those ways is when the provider looks like them, people are frequently more receptive.
I would agree with you on that, because, I have not announced this publicly, but last week I actually had to go to the emergency room. I'm okay, everybody, so no worries. But I did have to go to the emergency room last week, and the person who was assisting me was a Black woman, and I was like, I'm so glad you're here. And I didn't say why, but I'm sure she probably understood.
She picked up on it,
why I said that, because it does make a difference, because we hear so many things about people having negative experiences, or not being heard, or not being believed, and all these sorts of things. So it is important to have people in those spaces. But what you have done, you've gone even beyond that, and dealing with public health. So for those who might not understand what public health really means, what is public health?
Oh, it's such a broad space. And so the way that I like to describe it is that public health professionals are folks who think about public good as it relates to health. And now, as we talk so much about the social determinants of health, are things that people are exposed to in their everyday lives, like housing, education, poverty, et cetera. All those things connect to public health. And you might say, well, why would she even bring up social determinants of health when she talks about public health? Because within public health, people frequently think about their public health departments. They think about that governmental piece of public health. So whether you're talking about local county government, state government, or federal government, there are strong connections that can be made to the other pieces of our public systems. But there's also a piece around just the community piece, so that community health perspective. And that's more of what I do. So people who talk about public health practice, those are the folks who work in a local county, state, or federal health department. But all of us, whether you do public health, whether you do community health, whether you are an epidemiologist where you're studying disease frequency and statistics, all of us get degrees in public health. So I have a master's degree in public health. And so that was my formal training. But I tell people I learned the most about community health in my school, in my church, in my community, doing work. And then I went to public health school to learn the theory around that. But for me, really, most of it happened in the places where I did volunteer work, which was largely through my church growing up.
Oh, wow. Wow. That's something. That's something. And I'm going to segue just a little bit because you mentioned church and community and all of that. And I'm just going to pull the cat out the bag now. You may recognize Ayanna, Dr. Buckner, from first person I want to say this year that I interviewed for her book.
That's right.
For the Gardens of Eden.
That's right. And I have my copy here.
Yes, yes. I'm pulling that up real quick under her pen name of Rosie Lee. So tell us a little bit about what is it that you have this marriage between your desire to write and to tell compelling stories, but also that's a part of your day job, so to speak, is being a physician or being in the medical field. How do those two things kind of work together for you?
Sure. So, I mentioned I really kind of at my foundation think of myself more as a creative. And so I always wanted to write books. If you ask me, what did you want to be when you were a kid? I'm going to tell you a fashion designer and an actress. But for me, writing was always still a part of that. I started off writing poetry in school. That was really my passion. I didn't think I was that great at it. And so I'm like, I don't see anything getting published or anything. But I loved reading books and loved stories. And then I just remember just falling back in love with reading Waiting to Exhale and Disappearing Acts and all the Terry McMillan books. And I just was so captivated by it. And around that same time, I was also thinking about medicine and all the things that we do. And I don't remember what television show I watched on TV, but I remember seeing different things about health. And I said, I wonder if there's a way that I can combine these things. And so as I decided to pursue medicine, I said, I do still want to write books. I'm just going to have to figure out how to do that. And I remember a moment in my freshman English class in college. And I had this fantastic teacher. His name's Dr. David Lanou. If there's anybody from Xavier who's watching who remembers him, he was fantastic. We had to do these portfolios every semester. And he gave me just amazing feedback on mine. And he said, you were really onto something. And I remember saying, well, I guess I could kind of go this route, but I really want to be a doctor. So I'm going to have to figure out how to combine those two. So for me, that was that moment that really gelled. And I said, I'm going to figure out how to do that. And I'd been thinking about, putting health themes in books. And so I said, I'll sort through that. And so then it took me a while, but I eventually did that. And so, as you mentioned, my debut novel came out this past January.
Yes. And it's such a beautiful novel. I don't have the whole box and everything because I still kept the box that I got the book in and everything. But if you all go to the Brown Girl Collective social media and back to probably like December, you'll see like the beautiful packaging and all of that. And I'll be sure to link our conversation about the Gardens of Eden so that you all can catch up with that and buy the book.
Thank you.
But,
and I try not to tell, of course, we won't tell what happens in the book. But I think it's okay in this space to say that the book has themes around heart health, mental health, and the connection between them. So that's the focus of this book. The second book will have a different focus. And that second book will come out next spring.
Yes, you are busy. You are busy for sure.
A little bit.
Just a little bit. But yes, I just wanted to go ahead and bring that up because I know that there are people who know both worlds or both sides of you, and there are people who don't. So I just want, if they recognize the face, be like, I've seen her before.
I really appreciate that. And sometimes people ask me, well, why is it so important for you to carve out time? And so I really, feel like what I do in my everyday work, whether it's with my consulting work or with seeing patients, is I want to really normalize talking about health. I want to normalize talking about mental health. I think about depression and anxiety and bipolar disorder, just like I think about high blood pressure. And so for me, that was one of the reasons to really connect these things in this book. And I want people, we know people, and sometimes ourselves will deal with some of these things in our everyday lives. People don't always want to talk about it. And I want us to feel more comfortable talking about it. And so I thought, if I can weave those themes into this story and help people to see how these characters navigate through them, perhaps it will help people to feel more empowered as it relates to their own health and their family's health.
Yes, it really does, because, anytime, well, for me personally, I will speak, whenever I am reading, even if it's for pleasure, I'm also learning. And so I love being able to, get information or something that I might dive a little deeper into it, or it might remind me of someone that I know, and maybe I may mention something because, you coming from the perspective of someone who has experience in medicine, it's not like you just it's not like you just researched it and wrote about it. You actually know.
Yeah. And, people don't want to be preached at. And so,
Right.
in a doctor's appointment, the average appointment, you've got 20 minutes to talk with someone. And I want even doctors to be able to say, if you like reading, you might think about reading this book. These characters are navigating some of the same things that you're dealing with. And that really might help you. I want doctors to be able to use it, as well as just people in their everyday lives.
Absolutely. Absolutely. Well, you mentioned it a few moments ago, and I also mentioned it in your introduction, that you do work with the American Heart Association National Hypertension Control Initiative Advisory Group. That's a mouthful. But what is it? What is it that made that particular? Because there's so many different things, especially things that impact our community. But what was it that drew you specifically to want to be a part of that particular initiative?
So for me, I think about the diseases that most impact our communities. And those are the same diseases that most impact people that I know and love, family members as well as friends. And so I want to work on those things and try to make a difference in those things. So when I heard about the opportunity to serve on the advisory council, I said, absolutely. Because it's such an important thing. And, we talk so much about hypertension or high blood pressure, but there's still so much more work to be done. And so I really wanted to be a part of helping to make decisions and providing advice on what programs and initiatives are being done around that in our communities.
So what do you think is the biggest misconception or thing that people don't know about hypertension that they need to know?
I think the biggest piece and one of the things that bothers me the most is when people say, oh, my pressure just runs high, because that's not acceptable to me. Because especially when it comes to African Americans, sometimes people say, my mom had high blood pressure, my daddy had high blood pressure, my grandma had high blood pressure, I'm just going to have high blood pressure. Well, maybe, but maybe not. And is there a way for us to get ahead of it? And even if you end up with high blood pressure, then what can we do to best control that blood pressure? We have guidelines that say that we should really try to bring people's blood pressure as close to 120/80 as possible. And we find that frequently in the African American community, people who are treating us don't always treat it as aggressively as needed to bring that blood pressure down. And the thing is, you can live at 140 over 90 or higher, or maybe even 150s, or higher. But the thing is, that weighs on your kidneys, that weighs on your heart, that weighs on your brain. And so even though you may run high and it may not be what we consider, the level to have a stroke or a heart attack, it's still wearing on your organs. And so we want to do things, even talking about the things that we can do that may not be, a super heavy lift. Like I had a conversation with a friend today about simple things that can be done in making decisions about what you eat. So something is just about how much salt you use, how often you eat out, and being honest with ourselves about that.
Right. Right. That's something because my mother always watches and she would fuss at me like, you putting salt on it, you didn't even taste it. I'm like, well, but things like that we just do out of habit, putting salt on things, or even, like you said, eating out a lot, which that there are preservatives and different things. You don't know what's going in the food that you're eating when you're always eating out. And fast food, whether it's fast food or ordering, delivery, you still don't really know what's in it. So,
and unless a restaurant tells you that they are limiting salt intake, you need to assume that they're using a lot of salt, because it may not even taste like it, but salt is one of the most reliable things to flavor food. So most of us are shocked at how much salt's in the food that we eat. Fast food, eating out at just about any restaurant, again, unless they tell you that, they really are not doing that and you believe them. But also, frozen foods, as you mentioned, things that have preservatives are going to have high levels of salt. So even training ourselves to look at the food label and see, well, how much salt, how much sodium, because it's not going to say salt, it's going to say sodium. How much sodium is in this container and per serving, and how many servings am I going to eat? Because that's the other thing, right? Because even something like a frozen pizza has a lot of salt in it. Right. And we don't typically think about a frozen pizza being salty.
Right.
Even one with cheese that doesn't have meat on it, it's salty. It just is.
Yeah, that's so true. So yes, read the labels. I need to get somebody to come on and talk to us about that. But yes, it's important to read the labels, or like canned soups. I mean, just so many different
especially canned soups.
It's like, ooh.
Yeah, so when I'm shopping for elders in my life, I try to get fresh vegetables, but if I have to get something that's in a can, I'm going to get the low sodium version. There is one that frequently that says low salt, so I'm going to get that one.
So yeah, I mean, it's things
they don't always like it, but that's what I do.
Well, yeah. Hopefully, they're not going and adding it back in.
Right.
Right. So I mean, but that's something, just things that we need to be aware of. And back when you talk about, I'm thinking about social determinants of health. And like thinking where you might live is one of those things, or what's happening in your community. And we know that there are places in Black communities that are considered food deserts, where they don't have access to a lot of the same, the fresh food, things like that. And there might be, the best thing you can get is coming from the bodega or the convenience store, or whatever the case may be. So in some of the work that you do, public health related, do you help communities, be able to look at things like that?
Yeah, and so for me, my work is largely dependent on the client. And what the client, what the client's needs are. But absolutely, certainly I do. One of the things that I've done, even with teaching medical students, is to do an assessment that we call the windshield assessment whenever they're assigned to a community. So it's driving around and looking at what's in the community. I'll give you an example. Because frequently my former students would say, wait, so the work that you do with consulting work is so similar to what you used to teach us to do in school. And I'm like, yeah, actually people teach me how to do that. And so I tell them, when we were assigned to work with this elementary school, first thing we did was to drive around, and we had a form that we would fill out where we would look at the resources available in the community. But also look at some of the things that the community might need. And so then we would, as a part of our assessment, work with the school and talk about what types of additional resources they might need, and to figure out what recommendations we could make about doing that. And so I've also worked with community health centers, federally qualified health centers, or what we might call the community clinic, who put some of those same things in practice. For example, I actually advise a program where a federally qualified health center or clinic does something similar, and they're partnering with grocery stores and recreational centers, et cetera, to bring resources closer to the patients who have hypertension, and also to help those patients navigate around how to get the right types of foods and get access to exercise. Because frequently we'll say, oh, you can just walk outside. But, if it's not safe, either because of violence or because of a lack of sidewalks or what have you, then we have to figure out, well, what can we do? Even as a clinician, what can I do to help to connect those patients to resources?
And that is so important, because we know that, a lot of times the first thing is to put a person on a pill. And we're not necessarily against pills or medication or pharmaceuticals, but understanding that there are oftentimes other things that they can do. It doesn't just have to be taking this medication. It could be, if they do take it, it's just temporary while they work on some of these other things. But like you say, the challenge can be that if their community or their neighborhood doesn't support that, it becomes more of a challenge.
Yeah. And sometimes, even just prescribing the pill, this is where it's important to talk to your patient, because there are frequently reasons why people don't take their medications. And if you don't talk to a patient about that, when that patient comes back and their blood pressure is still high, you just write a higher dose of the medicine, or you prescribe a higher dose of the medicine. So, as we talk about social determinants of health and trying to figure out what's going on in that patient's life, it's, hey, do you know about, which things you should or should not be eating? So I'll give you an example around that. One of the projects I work with, we actually had a conference where we presented on our work around hypertension. And one of the docs mentioned that just in talking to her patient, she found out that the patient was eating like 2 hot dogs a day. Just because it was easy. She would stop at the corner store, you get hot dogs. She talked to the patient about it. The patient was enrolled in the healthy eating class for this high blood pressure or hypertension project. The patient cut out the hot dogs. Blood pressure went down. There are other patients who, can't afford to get their medicine. So what types of things can we do to help to address that? There are some patients actually in that project who there was a group of students working with this particular physician. And one of them was a nurse practitioner student who also is an attorney. And so he found out that people have what's called health harming legal needs. Right. It's a term we don't use often, but if you are not able to work because you have some legal issues, if we could rectify those issues, then perhaps those get taken care of, you're able to work, then you're not as stressed, you're able to eat and feed yourself and get healthier food, and you're also able to purchase your medicines. And so that's why just prescribing and those are just 2 examples, right? But that's why just prescribing a medicine isn't enough. So I really believe in lifestyle modification. I try not to use the word exercise too much, though sometimes I use it. We should talk more about activity, just because it's usually an easier word for people to talk about, and also talk about healthier eating habits. Yeah, we can talk about decreasing salt, but also help people to understand, and I tell them, I'm from New Orleans. I'm all about good food, so I'm not trying to tell you to, to eat food that doesn't taste good. Like that does not bring joy to my heart at all. But what are some practical things that we can do so that you can hopefully start with the easiest changes, low hanging fruit, make those changes. And then, as you mentioned, perhaps you'll be able to either totally get off the medicine or take a lower dose. People frequently get upset when they have to take 2 and 3 medicines, but they'll take 1. So we can even just get you down to 1 medicine. Like that makes a huge difference. And it also makes a huge difference with not having as many side effects, because, most medicines can cause some type of a side effect.
That is so true. That is so true. And I will put that comment back up because you are right, Jean. One of our former guests, as well as a regular viewee. Wonderful
I love
example.
That.
Yeah, absolutely. There are many things that play into that, and kind of back to my recent experience. I was telling my mom, I'm like, there's some things I need to do. And I'm like, if I have to go on medicine temporarily, I'll do that. But I also know I need to, some things I need to do, in terms of, physical activity, in terms of what I'm eating and things like that. excuse me, I will admit, single, no kids, right? Always been single, no kids. So for me, it's been easy to get what's convenient. But I don't have to cook because it's just me. But but for me, it's a thing of a mindset shift because why am I thinking that I don't have to take care of myself? Well, if I had a family, I would cook. If I had a family, I would do that. But like, why? I am my family. Why don't I?
Right.
Why don't I do those things for myself?
Yeah.
So it has been like a gradual mindset shift. That, I have to care for myself in the same way I would want to care for a family if I had a family.
But also, like, what are the barriers to you doing that? So if it's, hey, I'm going to make this fun for me, so I enjoy doing it. It's a fun time. I'm going to turn on the music. I'm gonna cook some things that I really like, and I'm going to cook on this Sunday afternoon or this Tuesday afternoon, and I will have food that I can eat for the week. And then I'm more likely, even if you don't, because even for me, I don't have to always cook the whole thing, but if I can just prep it so that when I'm hungry, it takes me 15 minutes to finish the meal instead of a whole hour, then I'm more likely to eat the healthy thing. But if I don't do any planning, and even if I'm like working from home that day, I, go to the kitchen and I'm famished, I'm most likely going to make a bad choice. It's just like where they tell you don't go grocery shopping when you're hungry. Like, don't make decisions about what you're going to eat only when you're like starved.
Right. That's true. That is so true. That is good. That is such good advice there. I can definitely appreciate that. But we were talking about medications, of course, and just the whole thing of public health. And one of the things I was thinking about as I was preparing for you is that making sure that we have people who are concerned about some of our specific needs, our meaning Black people, people of color, who are even doing these medical tests or helping to develop medications and things like that. Because I have heard, from previous guests and just things that I read that oftentimes people who look like us, who have our, physical makeup and, things that pertain to us as people of color, aren't even considered when they're doing these trials. So they don't even know how it's going to work.
It becomes an issue. And so, that's something that I think that some companies pay more attention to than others. Some companies, some researchers, etc. And so it's something that it's a really important issue that we have to keep working on.
So I know that you have taught as well. And in teaching your students, I love, the program that you talked about, like the windshield program where you kind of see what's going on around you. Windshield survey. I love the idea of that. Are there a lot of students who are looking to go into medicine? Or I know you said it's getting better than what it used to be.
Yeah, I think it's a tough time in medicine. It really is. And it's a really complicated conversation. Physician quality of life isn't always as great as some of us would like it to be. I think people have thoughts about physicians and what their life is like and how much they get paid, but sometimes people don't realize, number one, like how long you go to school, how much student loan debt you have, and then how long of hours you've got to work once you start. And so, the average primary care physician will, even after working all day, will still have to, go home and do notes to finish their charts. Some people call them notes, some call them charts. But, those things take a lot of time. And as I think there are continuing to be issues with reimbursement, how doctors and how hospital systems are compensated, and frequently also how that trickles down to the clinicians. I think, there is some concern about what the workforce is going to look like going forward. I'm certainly concerned about it.
Right. And thinking of, we haven't talked about it yet, but COVID-19, how did that change things for people in the medical
field? Because I think, at one point, they were saying that medical school applications went up a lot. At one point they called it the Fauci effect, I think. Yeah. And so, that's the thing. I don't know what it's like now, but I know that medical schools certainly realize that there are physician shortages. Medical schools realize it. The Department of Health and Human Services realize that there are always initiatives to work on physician shortages and nursing shortages, because those things are very real. And I'm very concerned about what it's going to be like, even for the rest of my lifetime, but certainly even after I'm gone, because people are making different choices now. So you'll see that, some schools are increasing medical school sizes. Some states are increasing the number of medical schools. And that's a big deal when a new medical school opens. And we really do need those things, because physician shortages and nursing shortages are very real issues. And, I know, what communities are going to suffer the most.
Right.
The communities that are historically at highest risk for illnesses, they're going to be the ones, I'm concerned about that. I'm concerned about prison populations, really getting the help that they need. Again, the communities that we're already worried about is going to get worse there first, because we know, like, COVID was a good example of that, right? People who have resources, it's not just about money, but money is a big piece. People who have money will find a way to get the things that they need. But what about folks who don't have that? And frequently these are the people who are holding communities together. They're the ones doing the essential jobs, right? And so who's caring about those people?
That's something to really think about. And just real quick, and then we have a question from the audience. I know someone who was incarcerated, a Black woman, and she was talking about in the speech recently. I didn't realize that women who have been incarcerated, is like they lose years of their life for every year that they are imprisoned. So yes, that is very important when you start talking about public health and, supporting those people as well. They're not, nobody to throw away human.
Exactly. And so, for me, that's even, as you were talking about this, I started thinking about, that's why, even though I'm not a pediatrician, but, that's why we've got to start with younger kids and developing them and developing their interest in science, so that they can help to address some of these issues. But also, if there's a way that we can provide the resources that they need, again, I'm talking about social determinants of health, so that they are not at such high risk for going down a path that might lead to being incarcerated.
Absolutely. Here's a question from the audience. How do you think the profession will look, RE, race, and gender?
Yeah, that's a good question. I think these days, again, we are seeing more people of color going to medical school, and not just medical school, but becoming nurse practitioners, becoming PAs also. We are seeing more, but we just really do still need more. Again, the shortages are increasing, and it's something that I think the work, certainly for as long as I've been in the field and studying, I knew that there were physician shortages. And so one of the things that I've done is even to volunteer as a reviewer for grants that are funded for the Department of Health and Human Services. And so that's one way that I kind of keep my finger on the pulse of things, to see what types of initiatives the government is funding around health, but also the healthcare workforce. And so, the question was about race, but also gender. I think, we're seeing, at least in some schools, we're seeing, a good representation of women. My thing is, I really want to see a lot of these people go into primary care. So my thing is, what type of incentives do they need to have to get them there? And so that's also one reason I mentioned some of the grant reviews that I've done in the past, because those things are important for primary care, but they're also important for rural health. That's something that doesn't get talked about a lot. There are physician shortages. I think about, what it's like in a big city, somewhere like Atlanta, where it can be hard, depending on your insurance, to find a primary care provider. So if we have those issues in Atlanta, what do you think happens, when you go a few hours outside of Atlanta to a rural area? And so again, when talking about health equity and the communities that really need help, we have to think about rural areas too.
I'm sitting here, I'm smiling on the inside. So I'm like, yeah, you're hitting all the stuff that was in my head. So thank you. Yes, because thinking about rural areas, a few months ago, I had the opportunity to go to the State House. We're both in Atlanta, and I was at the State House for an event with people in the D9 or Divine Nine. And one of the things that came up was the whole thing of, we look at Atlanta when it's time to vote and do this, that, and the other, because we live here, but there are counties in the state of Georgia that don't have physicians, don't have pediatricians, or specialists,
or hospitals. Hospitals are being closed down around the country in rural areas, and that's not getting enough attention. It's really not.
Right. So yeah, just the fact that, a woman could go, or a birthing person could go into labor and not be able to get the help that they need because there's nothing nearby. So that's one thing, to think about that. And then the other thing, as you were talking, that came to mind is the whole thing of specialties versus primary care, because from the things that I've read that research, that primary care, a lot of people aren't necessarily wanting to go into primary care. They want to go into these specialties because they feel like there's more money to be made and all those sorts of things.
Yeah, more money to be made. And I think sometimes people just really like those areas. For me, I couldn't imagine doing anything other than primary care. It really, that's just what I love. And so, to your earlier question about, how did I decide? I really follow my heart. For me, I did the things that I really enjoyed. I remember when I learned that there was a whole specialty called preventive medicine, I was excited. I'm like, so wait, so all these community events I've been doing and all the skills I've learned doing those, I can actually use those to help to address health. So for me, it's really fun. And so I think this is where we've got to, again, this is where STEM programs really come in. Really encouraging our kids to explore those interests and helping to make the connections for them about what they can do to really address these needs in our community is just really something that we need to do as parents, as aunties, as uncles, as godmommies, as teachers, as all those things. Because that's how we're going to, help to protect our community.
It is so. Absolutely. Because we do have to think about the future. And I love the fact that you talked about it is a collaborative effort. It is the community effort, for us to continue to speak up and speak out. Like I was just talking a moment ago about politically, who are we voting for? What initiatives are we voting yay or nay? For things like that. It's definitely something. It's not just you as your individual person or your individual family going to seek medical care. It's so much bigger than that.
Yeah. And really tying it in and asking yourself, like, how else can I fit this in? And again, thinking about me, I enjoy what I do in community health and medicine, but it's also how can I package this in a way to help other people understand this topic more? And for me, that's writing, in fiction. And so, and the reason I also talked about when you asked me about public health, and I talked about social determinants of health and the connecting to the other sectors within the public entity, it's because health connects to everything. And so if we can help to make those connections for people, health and education, they go together, health and public safety, addressing crime, those things go together, even, water safety, like that's a part of health, and helping people to understand those connections. That's how we can reinforce the pieces that need to be reinforced and also address some of these issues along the way. And sometimes folks say, oh, you just want health to be in everything. I'm like, but it is in everything. It really, really is. Yeah. And if we don't pay attention to it, the health issues in our communities are going to get worse.
Because I'm just thinking, last year I spoke with someone, of course, her name is not going to come to me right now, but the book was Before the Street Lights Come On. And it's talking about environmentalism in the Black community and the things that happen in the environment. So, I mean, that stuff is important as well. You know, a lot of times you think environment, you think, oh, ozone layer and, you know, the fish that are dying or whatever, you know, that we might see in the mainstream, but it's so much deeper than that.
And those things are super important too, you know? And so I think, and I'm glad that you said it, because so often when we see it on the news and we talk about it like that, it feels far away. But frequently these things are warning signs. And, you know, especially for those of us who like to think about how our people survived, you know, how people who, you know, people who were brought from Africa and enslaved, how they survived, they paid attention to things like that. Right. And so we don't need to sleep on those things either. And for me, you know, being a kid, I was one of those kids who like was 7 years old watching the 5 o'clock news and 6 o'clock news with my parents and my grandmother. And so just watching those things, and I'd be like, oh my gosh, that's a trouble. And that's, you know, those are worrisome things. And I wanted to figure out like how I can help to address them. And I think that's the piece, asking what can I do in my piece. And so I love that you talked about the ways that you found to do that, you know, by going to the Capitol and speaking out, because that's really the thing. You know, we can get really overwhelmed and say, oh, I can't do anything about that. Or we can say, hey, what can I do within my sphere of influence? What can I do?
Absolutely. So it's like the initiative that you might vote up or down, because, you know, thinking, you know, when I'm thinking about environment, one of the things that's really popping in my head is the whole thing about where some of, you know, people who wound up in some of the what we call projects, where were the projects placed? Right. You know, in the community, what's happening in the environment, you know, when were they built? Are they going in and making sure there's no asbestos? You know, just all these different types of things that have an impact ultimately on people's health. And
even, you know, even smaller, more basic things. If you're in a book club, when it's your turn to pick the book, because, you know, some book clubs rotate that way. Other times, you know, people vote on them, but suggesting books that have topics around health, whether it's a nonfiction book or whether it's a fiction book that has health themes. There are ways to do that. And it doesn't have to be my book. My book isn't the only book that has health themes. There are lots of them out there. It's just that because I'm a doctor, it's something that I've done intentionally. And that is a part of my platform. You know, the work that a part of my life's work to help people to talk about these things. But, you know, you can take it upon yourself to choose a book club topic that has, or choose a book that has health themes and have discussion questions around it. That's, you know, that's a pretty easy lift.
It definitely
bring some healthy recipes, make a whole thing of it.
Right. Exactly. Yeah. Instead of, you know, stopping and getting the fried chicken and, you know, what they call them, the meatballs, the bridal shower meatballs.
Yeah. And I'll say, you know, the family in my book, they are really big on plant-based eating. And I tell people, you know, I aspire to eat more plant-based foods. You know, I'm not 100% plant-based. But it's something I aspire to do because it makes sense from a health perspective. But I think, you know, so often we're like, oh, I can't do that or whatever. For me, it was just helping people to see like there are ways to do it. And not everyone in the family does it the same way. So really, even in that way, you know, talking about that, because if we can make, again, we talked about lifestyle, right? If we can make healthier choices, it can make such a big impact. And these people in my book really love food. They eat good food and they splurge. You can have treat days and holidays. I don't like calling them cheat days. It's a treat day. You know, and so there are ways that we can really commit ourselves to these things, but not have them feel heavy and make, you know, good, healthful decisions for our lives.
Absolutely. I love that because it's just all of it's so important, you know, because I just think even personally, well, you hear this thing, health is wealth, and it's true, and wealth isn't always about money.
Right.
But the concept of being able to live well, being healthy makes a difference, because you can
Mhm.
have all the big dreams and
Yeah.
desires and
Yeah.
plans and goals in the world, but if you lay it up somewhere,
Right.
over things that are possibly preventable,
Yeah.
prevention, that it makes a difference. So the more that we know, and the more that we're able to implement, and have people like you who are actually out there in the world, in the trenches, helping folks to get these things done, that's
Mhm.
just so important. But I would be remiss if I did not bring up the work that you did through School of Medicine, managing the projects after Hurricanes Katrina
Ah.
and Rita.
Mhm.
So just tell us a little bit about what that work was, because we know those things were devastating with
Yeah.
communities.
So it was just, a piece. It was my contribution. So when I finished residency in 2005, and so I took some time just to kind of catch a breath. So I was supposed to start at Morehouse School of Medicine on September 1st. But Katrina happened just a few days before, and I was packing up, trying to move to Atlanta, but watching all of this, watching the devastation unfold on television. And so just checking in on my family and friends, making sure they're okay. And I recall my mom said to me, well, I thought you would come here to help. And I said, well, I signed this contract and I have to be at the school they're expecting me to teach. And so I heard that Morehouse School of Medicine received some funding, some federal funding to help to address to rebuild, to assist in the rebuilding of the public health infrastructure after Hurricanes Katrina and Rita. And so they had some areas that they focused on, telehealth, um, electronic health records. There was a social determinants of health piece, and so they had these different projects that they were working on. And so I went to them and said, "Hey, like I'm from New Orleans. What can I do to help?"
Mhm.
And so it was really an amazing experience. I started off as the community liaison, which really I describe as I was willing to just jump on a plane and go wherever they needed me to go, to whatever meeting, to whatever community event, etc., to help plan, but also to coordinate some of the work. And for me, one of the most meaningful things that I did was that Morehouse provided funding to something called New Orleans Health Recovery Week. And
Mhm.
that's where the way I can describe it is this was in February of 2006. So it was really just a few months after Hurricanes Katrina and Rita. And their, pharmacies weren't open wide, in a widespread way. It was just really difficult to get the things that people needed. So we set up, I say we, but I worked with the New Orleans Health Department to
Right.
support them in setting up a week-long event of just free healthcare. People could get free eyeglasses, free medications, actually see physicians. So what's interesting is I help with the planning, but I thought I was going there to work to see patients one-on-one. So
Mm.
that was my plan. And this is a great example of why public health is so important.
Yes.
So again, I help with the planning, but I'm there. I'm gonna, work and work and see patients one on one. So I did my little thing. And then the person who was overseeing the coordination of the entire event got pulled away for a meeting. And they said, well, Ayanna, you've been in all these meetings with us. Can you come to the intake station and just oversee things for a couple hours? I said, sure. Well, then they said, oh, you did such a great job. We're just going to leave you there for the next 3 days. And
Mhm.
so for me, as a New Orleanian whose heart broke watching all of this happen was really, and I get choked up just thinking about it, was really an amazing experience because for me, the public health skills that I learned, um, just the basic public health principles and strategies, but also because my master's in public health is also in health management, being able
Mhm.
to do that on-site coordination and make sure that everything flowed smoothly was something I will cherish for the rest of my life. And so
Mhm.
for me, it's that, yes, certainly when you take care of a patient one-on-one, you make a difference to that patient. And I love that piece of it.
Mhm.
But I know that to get to the place that we need to get to in our country, we need people who are looking at the community, looking at the population, and that's what public health is about. And so I really enjoyed being able to give back in that way. So I was able to still, not break my contract that I signed, but still also, I think, address my mother's desire for me to come home and help.
I love that. And see, I didn't even know all that when I asked that question.
No, you did.
So yes, but I just think that, that really gets to the heart of, what you've done, what you continue to do, what it means to you, that you are able to help, a broader range of people. Because yes, we need the good people that's gonna, hold your hand and take your high blood pressure, or prescribe. We need that. We need that, but then we also need people who are helping to make sure that the right systems are in place. Right. That allow us to be able to get the kind of care that we need on a day-to-day basis.
Absolutely.
Whether you're, in Atlanta, or, in some rural area, or in the case of, like Katrina, a national disaster, or, you also did some work in some oil spill impacted communities as well. It's all of those different things that are important. So I love what you're doing. And, when we talked back in January about the book, I love the book, but I love this equally as much, just because, it's your heart. And I always say all of us are multifaceted. So we get to see, that creative side of you, but then we also get to see the work that you are doing in the world. We have a comment here. Thank you for touching on the societal and environmental pressures that are impacting health and wellness. Yeah, yes, it's not just the individual side. Yeah, and I enjoyed the Gardens of Eden. Yes, such a good book.
Thank you so much.
Yes. So I know that you have a lot of things going on in your life. You have your active practice, your active consulting practice, as well as you're continuing to write and things like that. Are there any particular things that we can be on the lookout for from you in the near future?
Yes, thank you for asking. So I'm working on the second book in the Gardens of Eden series, or maybe I'll say my alter ego is working on it, however we want to say that. But the second book in the series will come out next spring. So I hope people will read the first book. And if folks are interested in having Rosie Lee to come to a book club, or you want to invite Ayanna Buckner to speak at some community event, I'm happy to be in touch for either of those things, because I really want us to have just the resources that we need and be empowered to make a difference in our communities.
Absolutely. So if you want to get a copy of The Gardens of Eden, you can go to the Brown Girl Collective bookstore, browngirlcollectivebookstore.com, or, your favorite place to shop, wherever you choose. But it's nice if you do it here, because it helps to go towards the work and bringing wonderful people like Rosie Lee, aka
That's right. Thank you. Thank you for all the work that you do. I really just appreciate it, because you are doing the Lord's work too. You really are.
Thank you. See, I'm not gonna cry today. But it is, talking about something from the heart. This definitely is a heart work for me. I love being able to have these conversations, because they are so important. And like I was telling you earlier, every time I read something, I learn something, it expands my horizons. I'll go and tell other people, you need to check this out, or you need to, think about this or consider this. So before we go, is there one thing that us regular lay people could do to really have an impact on public health, community health? What things can we do that would make a really big difference?
I'm going to keep it. I'm going to go real old school with this, and I'm going to say let's try to think about each other. So, think about how we can support each other in health, how we can support, pay attention to what folks are going through. You just never know what struggle someone's carrying. but and also I think a piece of that is recognizing that mental health is health. So maybe if I can say those two things, because it's interesting. As I was thinking about, we can think about how to support each other. Then there's always someone looking out for you because you're looking out for someone else, right? But also what goes along with that is sometimes folks are just struggling and they just need to know that there's someone there for them. So that's for me how that mental health piece comes in, because it's so connected. So I think I stole 2 answers, but I'm
that's fine. You can whatever you like, whatever you like. It's all good.
But
here.
I warned you that that connection, the physical health and mental health connection, is super important to me. So
it really is, and this is Mental Health Awareness Month starting today. So just to keep that in mind. So throughout the month, I will try to do some things to share some resources. And actually, we have a show later on in the month that is really about mental health. So
I love that.
Yes, so we're really going to dive in because it is an important topic and it's not taboo. It's not taboo, none of those things, as we need mentally, spiritually, emotionally, all these things, physically, all these things go together. So thank you again, Dr. Ayanna.
This was such a great conversation. Thank you.
Yes, it's been a pleasure. And, the people that are here watching live, please share this out, not just this conversation. Go and grab a copy of The Gardens of Eden. I will be linking that now that you know who it is. I will be linking that so you have the opportunity to watch that conversation from January as well. And please just continue to be on the lookout for all of the wonderful things that Rosie Lee, aka Dr. Buckner, has coming down the pipe. So I'm gonna let you go for just a second. Don't hang up yet. Just let you go grab your water, whatever the case may be, and I'm bid everybody else a good night. So
sounds good. Thank you. Thanks, everyone.
All right. So that was such a wonderful conversation. I loved having the opportunity to talk to her again and in a different capacity, but yes, bring both worlds together, because how many of you know that we all have many facets to who we are, and I think it's a beautiful thing when a person can actually be operating in their gifts, their multitude of gifts, and I'm sure there's probably some other ones that we haven't seen yet. So, that is such a powerful thing. So I do look forward to seeing everyone again next week. I don't have the book in front of me, but I believe we're going to be talking about rage. How about that? About anger. And basically talking about the fact that it's something that's natural for all of us. And, being angry or righteous indignation oftentimes gets a bad rap. So the information about next week's show will be up shortly tomorrow. And I look forward to seeing all of you again then. So in the meantime and in between time, you have a wonderful rest of the week and continue to do all that you can to live well. Take good care. Bye-bye.